What's up, guys? It's Dominique, aka That Therapist. For those of you that don't know me, I am the lead clinician and CEO for a group practice known as Yellow Bird Counseling. Well, what's the Yellow Bird Counseling, you might ask? What do y'all do there? Well, our normal day-to-day activities include providing individual, couples, family, and group therapy across the state of Alabama for children, teenagers, adolescents, adults, and elders. We have a team of therapists that specialize in an array of different areas to help meet the needs of the population at large. We do cater to BIPOC and LGBTQ individuals, providing a safe space for them to receive treatment that allies with their identity. So that's what we do for our normal day-to-day activities. But what do we do here on social media? Well, on social media, our whole goal is to break the stigma that surrounds mental health and wellness by sharing with the general population reasons that we could all benefit from having a therapist outside of simply just having a mental illness. So that's what we do. We want to break that stigma by way of education. So we choose topics that are digestible for anybody on a varying level of understanding so that we can help you become acquainted with a treatment modality that, if incorporated in your own life, you will see a lot of benefit mentally, physically, emotionally, and even spiritually. So that's what we do, right? That's what we do. But a lot of times there are barriers to people receiving therapy, right? A lot of times therapy, quote unquote, does not work for some people. So I wanted to address that this evening. What are those barriers? What causes therapy, mental health therapy, not to work for some people? Or why do some people think that mental health therapy will not work for them? Tell me in the comments what your thoughts are. Before I get started, I like to see where everybody's at. So on each platform, tell me, why do you think that therapy doesn't work, or reasons maybe that you have heard people saying that therapy does not work? Go ahead and put it in the comments. Let's see what we come up with, right? Give y'all a couple moments. Happy New Year, everybody. Happy New Year. Happy New Year. I think this is my first live of the new year. Is it? No, it's not. No, it's not. Is it? Is it? I want y'all to tell me why therapy, in your opinion, does not work. If you can, please share the live with friends, family, coworkers, because again, our whole goal is to break the stigma that surrounds mental health and wellness. And one of the best ways to do that is spreading the word. So if you have somebody that you've been trying to educate on the topic, or if you are not educated on the topic and you know that other people in your life are also not educated on the topic, it would be good to go ahead and share it with them. There are several ways to share. You can share on the platform that you're currently watching us from. You can also click that share. You can click that share arrow and you can copy our link and put it in a text message, a DM, Messenger, Snapchat, email, whatever form of communication you decide to use, or whatever is the best way you can reach your loved ones. Definitely go on ahead, copy and paste that link and send it to them. If you're in our community, you can just simply copy and paste the link that I sent you in community this evening. All right. So if y'all can please do that so we could get the word spread about mental health and wellness, and get education on why therapy doesn't work. Okay, right? So let's get into it. first, I want us to talk about the barriers that can be barriers to a person even starting the therapeutic journey. Okay. I want us to talk about first the barriers that could be in the way of someone even starting their therapeutic journey at all to begin with. Okay. So let's get into it. Of course, I love Psychology Today because several practitioners write articles on Psychology Today, and it's a great resource for mental health topics. As a Psychology Today user, I also get several magazines with articles like these. So content for days, baby, content for months, years, weeks, centuries. Let's get into it, okay? Seriously. All right. So let's talk about some common barriers that Dr. Andrea Bonnoir, I want to say that, I think that's how you say it, Andrea Bonnoir, okay, outlines for us in Psychology Today. Okay. So one of the first barriers people face is financial concerns. A lot of people still think that the only way that they can achieve therapy is paying a bunch of money for it. Sorry. A lot of people are not educated that therapy is covered under your insurance plans if you're an insurance carrier. People are not aware of reduced rate therapy, such as the therapy that Yellowbird provides. We're probably actually the cheapest in the state as far as reduced rate goes, because again, I am a practice that caters to the community. So, and we make it so that it's beneficial for both the therapist and the client. We have several ways that we do that. But a lot of times finances are a barrier. Oh, I can't afford that. Oh, I can't afford that. So if that's been you, or if that's been something that you have said, I want to talk to the insurance carriers first. If you're somebody who has insurance, health insurance, right? The first step that you can take is there's a customer service number on the back of your insurance card, okay? And those of you that are able, if you're able to, go and grab it real quick if it's near you. But there's a customer service number on the back of that insurance card. And you'll call that number and ask them, what is my patient responsibility for mental health therapy? That's what you ask them. You say, what is my patient responsibility for mental health therapy? And at that point, the representative on the other end will tell you, okay, for you to have therapy visits under your insurance plan, it'll cost X amount of dollars. You may be surprised and hear them say that you don't have any patient responsibility, which means that your insurance covers your therapy at 100% of the cost, meaning you just show up to your therapy, your provider, me, or somebody like me, processes that insurance claim, and we get our reimbursement from the insurance company directly. Another ideal circumstance is that you may just have a copay, right? With a copay, you may just have to pay $20, $30, $40, $50. Usually, I haven't seen copays be more than $50, but you might have a copay of $50 a visit. So even with that, you could budget at least one therapy visit in per month, right? A lot of people, even with the $50 copay, they can at least fit in one session a month, if not two, right? So if you, and $50 could be easy for a lot of people to find, meaning there maybe there's a vice that you have that you spend $50 less on in order to achieve your therapy need, okay? Maybe there you buy $50 worth of snacks every month in some capacity. And so you would buy $50 less of snacks. $50 is a whole lot easier to come up with than $150 per session, right? And you may even be able to be seen more frequently. But usually, if you have a copay, in general, I haven't seen them be higher than $50, and I've also seen them be as low as $10. So the first step for you before you count yourself out financially would be to call a customer service number, because many Americans have health insurance. That's a commonality that many of us have. Many Americans are employed by someone who offers them health insurance. So the first thing that may benefit you if you have counted yourself out of therapy for finances is to call that customer service number on the back of your insurance card and ask them what your patient responsibility is. All right. There are people that have a deductible, which means that's the amount of money you have to pay out of your own pocket before your benefits start to kick in for your insurance and they start covering the cost of your health insurance. With that, it may benefit you to see a private pay therapist, okay? Just depending on their price range. It may benefit you to see somebody who their rate per session is lower than what your deductible rate is per session, but that person won't be able to take your insurance if you go that route. Usually with a private pay therapist, they're not paneled with insurance, and that's how they're able to be private pay. Because those of us who are paneled with insurance, we legally have to accept your insurance if we know that you have it, right? So we legally have to run it if it's a panel that we have an agreement with, such as Blue Cross Blue Shield, Cigna, Aetna, Viva, panels like that. We have to take it if we're paneled as providers for those insurance. So what we do here at Yellowbird is we keep therapists that are specifically for folks that want to pay private and make sure that rate is much less than what a deductible rate would be. Then we have folks that see our insurance therapists. We also have folks that they may not be able to do a copay, a prepay, any pay. So we do have a set of therapists who do offer free sessions for people in need. So that is also something you would want to look for. You might ask, if you work with another practice that doesn't have a setup like that, you might ask them if they have a private pay scale, a sliding scale, or a private pay reduced rate, or do they offer any free services, okay? Because it is ethical for us to offer some amount of free services that's actually in our code of ethics about pro bono work. So definitely don't count yourself out before you call the insurance company, calling that customer service number on the back of your insurance card, or asking the provider if they offer reduced rate services or even free services. Okay, a lot of us are doing more and more of that these days. But yes, it's not as unaffordable as you might think, right? So if you haven't called anybody, you haven't talked to anybody, you truly don't know that you can't afford it, right? Right? Even if you don't have a dime to your name, you still don't know that you can't afford it, right? What kind of questions do you have? Because that's a big one. That's a big one. Finances is a big barrier to therapy treatment. So with that, what kind of questions do you have? Also, please remember to share the live so that your friends, family member, coworkers can also be privy to this information. Because again, our whole goal is to educate the general population on reasons we could all benefit from therapy outside of having a mental illness. So this is valuable information for everyone to be aware of, okay? So please be sure to share. Again, you can share on the platform that you're on. You can also click that share arrow, copy the link, and you can send it via text, put it in Messenger, put it in a DM, put it in, an email, whatever, okay? If you're in our community, again, you can simply copy and paste the link that I sent you in community and send it to your friends and family members for them to come in now or watch later at their convenience, okay? Perfect. Let's see what kind of questions. Let's see. Is there any questions? Let me look. I don't see any right now, which leads me to believe people are following pretty well. Good. Again, I try to make this digestible information so that it's not going over anybody's head. Okay. All right. Perfect. Well, let's keep it going. Let's keep it moving. So finances, that's the first barrier. If you're just joining us, a lot of times people believe that they can't afford therapy. And so that is where we started. Okay. If you are joining us on a platform where replays are not available, please click the link in our bio so that you can follow us on our other social media platforms where replays are available. Okay. All right. Let me see. I think I got a question. Why is the title Why Therapy Does Not Work? Well, because we're talking about the barriers to therapeutic intervention. Right now, we're starting with the reasons that people don't initiate therapy to begin with. We just finished with talking about how people believe that finances is a barrier. And the next point that we're going to cover is, hold on, I'm sorry. Fears of awkwardness and unfamiliarity. Okay, that's the second point. So that's why our title is Why Therapy Does Not Work, because we're talking about the barriers to why therapy does not work for a lot of people, or why a lot of people don't engage. Does that answer your question? Good question. Thank you for the question. All right, let's go on to awkwardness and unfamiliarity. That's the second common reason that people don't initiate therapy. What do I mean by fear of awkwardness and unfamiliarity? Talking to a stranger can be hard for a lot of people, right? Feeling as though you're going to have to share your entire life and share all your most deepest, darkest secrets right there, right then, right now. That's what a lot of people believe that therapy is, and they believe that therapy begins that way. But what people don't know is that therapists are trained in helping their clients feel safe and valued in a therapy space. We are trained to do that. A lot of what, there's a phrase that we use as mental health practitioners called meeting the client where they are, meaning that we're not going to initiate treatment for anything that you do not also agree with. We're not going to have you come into your first session and expect you to bare your entire heart to us, right? At first, it's usually a preliminary meet and greet. You meet the therapist, they meet you. You talk about what brings you into therapy. The therapist talks about how they can offer you assistance in the areas that you have presented to them. Then, as the relationship moves forward, and as you start to build rapport, is what we call it, or for a layperson, comfort with the therapist, then you share more and more as you're ready. But it's a common myth that you got to come in, bare your whole soul out, and you're going to leave feeling worse than what you came, right? But again, what you have to understand is part of what mental health practitioners are trained to do is assist the client with finding their comfort level and what they're willing to share in therapy. Okay? So, again, without asking questions, and another way that you can kind of overcome this awkwardness and unfamiliarity is book a consultation with a therapist that you are interested in. A lot of us offer free consultations in our practices. So it would be best, if you're feeling this fear of awkwardness and unfamiliarity, to schedule a consultation first before you commit to a session, so that you can express to the therapist, hey, I kind of feel awkward. This is my first time to do therapy, or I don't really know what to expect. Can you help me understand what I can be prepared for in the first session? That way you'll know about it before you even get there. You've already cleared it with your therapist. You already know what you can expect from your first session, so you don't feel blindsided at all. So that is also an option when you're dealing with fear of awkwardness and unfamiliarity when initiating the therapy journey. Sorry, I wanted to look to be sure. You're most welcome. You are most welcome. Is it Qualamia or Qualamaya? Is it Qualamaya or Qualamia? Can you spell it out phonetically? I don't like to mispronounce people's names because I hate for my name to be mispronounced. So I want to be sure that I'm pronouncing people's names correctly as well. He good. He laying on my couch. Qualamia. Got it. Perfect. Mr. Carter's doing fine. He's just, chilling after a long day of barking and getting on my nerves. Yes. After a long day of barking and getting on my nerves, Mr. Carter is resting like he has worked a 12-hour day and pays bills around this house. Okay? Yeah. All right, let's keep moving. Make sure I'm trying to keep an eye on all these, on the comments, to be sure I don't miss any questions. All right. Purr. All right. Feeling underrepresented in therapy communities, which is a common and very valid concern, okay? So many potential clients might balk at therapy because of the difficulties of finding a therapist who will get their particular life experience or background. It makes perfect sense that someone might prefer a therapist with a special understanding of particular challenges. So, also a therapist that looks like you. I'll say for me, as a BIPOC person, Black and brown person, therapists only represent about, Black therapists or brown therapists, we only represent 4% of the overall profession. That means that 96% of therapists are white, right? And may not have an understanding of different cultural nuances that us as Black and brown people experience. So that's very valid of a concern. However, I would not say that counts them out. Myself, as a Black-owned practice, I do have white therapists that work under me. But with these white therapists, I am careful to be sure that they are culturally competent to work with Black and brown folks, and also people in the LGBTQ community, as that is the two populations that I cater to, right? Also trauma. I also cater to individuals, whether they're Black or brown, whether they're LGBTQ, but they've been traumatized. So they could be white and they have a history of trauma. I have several white clients who we are working on trauma with them right now. But as the practitioner, it's important, if you're going to be working with people that don't look like you, or don't have a relationship style like yours, that you are educating yourself on that and taking continued education on areas such as cultural competency and learning about nuances and ins and outs with the LGBTQ community and treatment that is effective, and maybe the struggles that LGBTQ people encounter, right? So it's very important for the therapist to be aware of that. It's fair for you to ask a therapist, if all you can find is a therapist that doesn't look like you, asking them about what kind of training they have in cultural competency. That would be fair for you to ask them. What kind of continued education have they pursued in cultural competency? Also, how many clients do they have that look like you? Even if they don't look like you, how many clients do they have that look like you? So if you're seeing a white therapist who 75% of their clientele is Black, you might be almost as comfortable to see them as you would a Black therapist, right? Because you know that a lot of their clientele looks like you, and at least even if they don't look like you, you can have trust that the experiences that they're working with are similar to the ones that you might be dealing with, right? But that's very fair. I try to tell Black and brown people, as best as you can, please try to get with one of the 4% of us. But if not, definitely ask, hey, what's your level of cultural competency working with Black people? That's a fair question. If the therapist gets offended, hang up and call another therapist, right? If the therapist gets offended at that question, I'm telling you as a therapist, hang up that phone, call another therapist, because how dare they get offended at you trying to find a comfortable place to receive mental health treatment. We don't have the luxury to get offended at a client asking us questions about how well we're able to take care of them. What kind of questions do you have before we proceed? What kind of questions? Yes, the percentage is very low for us as BIPOC therapists. We are very hard to find. Would you recommend a trial period beyond the initial consultation to ensure that you are comfortable with the therapist before settling in? Sometimes you can feel like that person is not meeting you where you are and need a change of pace. That's a good question, but there's not a simple answer to it. Let me try to answer it this way, because that also kind of goes along with feeling, with this point that we're on. But that's a great question, Sharon. First, it's good for as best as you can to try to outline before you reach out to the therapist, try to get an idea of what you're looking to get out of therapy, right? And so if you're looking for trauma therapy, you want to go to a therapist who specializes in trauma-informed care. While there are several great therapists who don't specialize in trauma that are great for other things, you probably don't want to be seeing a therapist for trauma if they don't specialize in that. So you want to be sure you know what you're seeing your therapist for as best as you can articulate it. I understand that a lot of people may not exactly know how to put it into words, but if you describe it to your therapist, they should be able to help you articulate what it is. So that would be something I would ask for in the consultation, so you don't have to get started with somebody that may not be a good fit. See, are they able to work with the particular areas of concern that you have. What kind of experience do they have? And if they don't have a lot, but you like their personality, then you might say, okay, well, can I try X amount of sessions? You might say, well, can I try 3 sessions? If those 3 sessions go well, then we can maybe continue. But you can always start and stop, right? I would take it a session at a time, though, especially if they work with the particular concerns that you have. I would take it a session at a time. Also, it's okay. I know some people don't feel comfortable, but you also need to advocate for yourself. It's very important to advocate for yourself in the healthcare field. So just like when you go to the doctor and you advocate for yourself, you're allowed to advocate for yourself in therapy. So if you feel like there's something that the therapist is missing, it is fine for you to tell them that. I ask my clients at the end of each session, is there anything we missed? Is there any questions you have? Or is there anything else you feel like you need? I ask those 3 questions standard. Is there anything we missed? Is there any questions you have? Or is there anything else you need today, right? To give the client the opportunity to review the session in their mind and say, I needed this and I didn't get that. That would be the time to ask. Even if your therapist doesn't ask that at the end, still let them know, hey, I think we missed this. Or, hey, I'd like to talk more about this. So I would definitely say, try to align your needs with the therapist that specializes in your needs. And if that's not possible, I would just tell them up front, hey, I want to give this a trial of about 1-2 sessions, or maybe even let's just see how this first session goes. That's fine too. Thirdly, if you like the therapist and you believe you just kind of get the feeling that they could help you if they knew, then go on ahead and tell them, hey, I think I need more of this, or I think I need this, and talk that out with the therapist. Again, if they get offended over any of that, you probably should find a new therapist. Does that help, Sharon? Great question. Great question. Great question. Let me see. I thought I saw something here. Do you think a lot of therapists would get offended from that question? They shouldn't. They shouldn't. I'll say they shouldn't. If they do, you want to find another one. Because I'm telling you, as a therapist, what's appropriate to ask a therapist as a client, right? If you would ask your primary care doctor, then you should be able to ask your therapist that. And if they don't give you the feeling of comfort that you can talk to them openly, then it's time for you to find another therapist. Good. Perfect. I'm glad that was helpful. Good. Hold on, y'all. My phone's about to die and we'll lose Instagram. Give me 1 second. Our dog, people are asking about you. I'm bringing Mr. Carter for y'all to see. I just scooped him up off the couch. Say hi. Everybody say hi to Car Dog. Say hi, Car Dog, to everyone. They were asking how you were doing. Say hi, Car Dog. Good. All right. Let's get back to it. All right. Perfect. All righty. So let's go back to our last couple of barriers that people have when starting. Fear that you will feel worse before you feel better. My response to that is think of when you have a cut, all right? Think of when you have a cut, a cut or some sort of injury. And we'll do something simple, like you have a cut or some sort of gash. What happens when you have to clean that out? Can y'all tell me in the comments what happens, like if you have to use alcohol to clean it out, or peroxide or whatever? What happens when you have a cut and you have to use something to clean it out? We're gonna call the therapy peroxide or alcohol. What happens? What happens when you have a cut and you have to treat it, clean it with alcohol or peroxide? What happens? It burns. It burns, right? It hurts like hell with alcohol, right? But what happens if you continuously keep it clean? What'll happen after a while when you put that alcohol on it? What will happen? Will you feel it? Will you feel it? If you continue to keep it clean after a while of putting that alcohol on it to clean it, will you feel it? It heals. It heals, and you won't, after a period of time, depending on the injury, it'll stop, right? I say that because if you do experience discomfort in therapy, it's part of the healing process. A lot of times healing does have discomfort with it, but that is why your therapist is trained to help you cope through that process. They are coped to give you the amount of comfort that you may need in order to get through it. As far as getting worse before you get better, it may be that you become aware of things, but getting worse is probably not what's going to happen. In fact, of the people that go to therapy, therapy is effective for approximately 80% of people who attend. And it's only not effective for about 3 to 10% of people. And that's for an array of reasons. We'll get into that next. But the majority of people that go to therapy, it actually does work for them. Statistically, we see about 80%. And then, there's 10% of error, and we'll get into those reasons and how you can mitigate those problems as well. Some of what I have already told you will help you mitigate those problems, making sure you do a consultation, making sure that the therapist is able to treat your particular areas of concern, being sure that you have a therapist that aligns with whatever your finances will allow. And we talked about how to go about that earlier. If you missed that, then don't worry. You can watch it on the replay because we did talk about the financial barrier first. But there may be some discomfort that your therapist will have to help you get through. But again, you can be in charge of that by telling your therapist what you're comfortable dealing with and what you may want to wait on. Okay? You don't got to go all in. You can take your time with it. So it's like a little ow, ow, like when you're dabbing a cut, like ow, 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 like that. Yeah. So it can be like that with therapy. You can just do a little bit, come back. Do a little bit more, come back. A little bit more, come back. You can do that. So you don't have to feel rushed into this discomfort. But your therapist is going to be responsible for helping you stabilize, meaning returning you back to stability emotionally and mentally before the session's over, based on whatever y'all covered. Okay? And they should be checking in with you to see how you feel after covering whatever it is that y'all covered during session. So, getting worse, no, but feeling discomfort, yes, I'm not going to lie. It is a side effect, but that's a side effect of a lot of treatment, right? Yep, it hurts less and less, heals over time, and therapy is the same way. So, yes, Mr. Carter, stop it. All right. And the last points are concerns about scheduling or time commitment. The ideal of a weekly therapy appointment can be daunting to many, and it's probably near the very top of logistical reasons that people hesitate to try to find help. They feel like they don't have time, right? They feel like, oh, I don't have time. So that could also be something that you would talk to your therapist about. A lot of therapists now are starting to offer evening appointments, such as myself, and weekend appointments, such as some other therapists on my staff that offer weekends and evenings. Okay. And then we still have our therapists who offer the traditional like 9 to 5 hours, or even 8 to 5, and maybe even 7 to 5. I don't really want my therapist doing earlier than that or later than 8 p.m. But for us personally, the first session can start for any of my therapists at 7 a.m. and the last one could start at 7 p.m. Right? So, and then we have people that, like, if you're on a nursing schedule and 7 a to 7 p are at work, then we have, therapists who do work weekends. So definitely look for therapists for the times that you do have available. And if you just can't find any time, schedule a consultation and let the therapist know what your obligations are, and I'm sure they can help you find time. Okay? I'm sure they can help you find time. So again, when you have these you can get a lot out of these consultation calls. So these questions, if you need to, go back and watch the replay so you can write these questions down if you have not yet started therapy, so you know what to ask. Okay? That'll help mitigate a lot of these issues. All right? Okay, any questions before we move on? Any questions before we move on to other reasons why therapy doesn't work? Thank y'all. Thank y'all for the gifts. I appreciate you. Let's see. Everybody good? Again, you can watch these replays on our other social media sites. Just click the link in our bio to follow our other social media sites so you're able to watch this live from the beginning. Okay? You can click our link. Hush, Mr. Carter. You can click the link in our bio so that you're able to watch this live from the beginning. Okay? Hello. Welcome in. All right. Let's go on to some reasons why, after, like, let's say you get past these initial barriers, right? And you do start therapy. Let's look at some other reasons that therapy could be unsuccessful. So going back to the idea of your medical doctor. If you need, and going back to what we talked about as far as specialty areas, it is very important that you go to a therapist if you have trauma. We're going to use that as an example. It's very important that you go see a trauma therapist to help you deal with your trauma. You don't want to go to a general practitioner as far as therapy is concerned to deal with trauma. No more than you would go to your general practitioner to give you a foot surgery if you needed it, right? You're not going to go to your primary care professional for surgery. You're probably going to go to a surgeon for surgery and go to your primary care maybe for follow-up, possibly, okay? So it's important that you know what type of therapist you're working with to be sure that it aligns with your therapy goals. Because if not, then that could be a reason that your therapy doesn't work. If you go to a trauma-informed therapist for trauma is probably not going to work out best because it's what we call outside of their scope of practice. Okay? All therapists can't do therapy for everything, right? We just think, oh, I found a therapist, period. No. I need a therapist for these reasons. You want to be sure that your therapist is actually trained to work with you in those areas. So if you go to a therapist that's not trained in the areas that you have concerns for, it could be an issue that causes therapy not to work, and you'll fall in that 3 to 10% of people who therapy does not work for. Okay. So there's also, I hate to use Christian therapists. I'm so sorry. I hate to use y'all as an example, but it's going to be an example that the general public will understand. Let me preface this by saying all Christian therapists are not like this. I have 2 Christian therapists in my practice who do very well, and this is not a problem that they have. But some therapists can get kind of caught up on pushing their ideals onto a client. Oftentimes we see that with spiritual therapists trying to kind of push their belief system, which we're trained not to do. It's very unethical. So let me start there. So if a therapist is doing that, be sure to say, hey, I don't agree. And if they give you pushback, definitely find another therapist. But the persecutory therapist, okay, is another reason that therapy may not work out. But again, it's a small percentage. It's still out there though. So I want to be sure that I educate you and make you aware of it. So if that is something that you're afraid of, in the consultation, ask the therapist, okay, how do you, like, if they are a heterosexual therapist and you're part of the LGBTQ community, ask them what their thoughts are on the LGBTQ community before you start working with them. And they will tell you in their call how they really feel, right? If a therapist is not able to overcome their biases and have not examined their implicit biases, you're going to know that real quick, okay? They're going to start telling you, kind of, I can't think of the word right now, but they're going to be very, they're going to show you what their thoughts are. Okay. So if you're afraid that a therapist is going to try to push their beliefs on you in any particular area, ask them, or say, hey, if you're going to a spiritual therapist and you're like, hey, actually, I don't believe in God. How do you feel about that? Ask the therapist, and they'll tell you. And if their answer does not align with something that you feel comfortable with, you already know before you've given them any of your information. So definitely, again, utilize that consultation. Utilize that consultation, especially if it's your first time in therapy. Utilize that consultation so that before you start unpacking, you already know what type of therapist you're dealing with. Okay? Let me look to see if there's any questions about that. Any questions? If they ever become uncomfortable with the question, I'm out. Yeah, they shouldn't become uncomfortable with these questions. I'm telling you, as a therapist, if a therapist becomes uncomfortable with your questions, they're not the therapist for you. Okay, they're not, because it's not about us; it's about you. And so if they become uncomfortable about something that's about you and not about them, find someone else before you start unpacking your wounds with them. Okay? But again, this is a small percentage of people who, for the most part, people that go to therapy have a good experience. But I'm talking about these 3 to 10% of people who therapy has not worked for. And these are the reasons why. Either they're working with a therapist who does not specialize in their area of needs. Their particular needs area. And I forgot to name this because this is a different article. This article is by Dr. Ishkara Filva. Okay. So we got the persecutory therapist. We've got seeing a therapist that doesn't specialize in what your presenting concerns are. Cheap validation is the next. This is a danger in many ways This is a danger that's in many ways the opposite of persecution. I call it cheap validation. That's what Dr. Filva calls it. Some therapists appear to go along with the patient's perception of the world, leading to all grievances or supporting the view that all the patient's problems are someone's fault. So if you have a therapist that isn't challenging your perspective, or at least asking you if there is another perspective, or even asking you how you got to the perspective that you have, then just simply validating you and agreeing with you, that's not therapy. That's not helpful, right? You came to them for help. And if everything that you're saying is right, and if it's really someone else's fault, then how will therapy actually help you, right? For my clients that come in and they say, this person did that to me, or this person did that to me, and they did this to me, I'll say, okay, how did you allow that? And I'm not talking about for abuse, okay? I'm talking for like if someone takes, like maybe if the client is allowing someone to use them, I'll say, okay, yes, so-and-so did that, and that was wrong that they did that. But what was your part? Okay, what was your part? And the client thinks, I didn't think about it like that. I think my bound. They may not have the words, but something to the effect of, I didn't maintain my boundaries. So then at that point, me as a therapist, I need to assess with the client why it's difficult for them to maintain a boundary and giving to people that are taking advantage of them, right? So I may ask them, what role did you play in that? Instead of just saying, oh yeah, so-and-so was so wrong. You're right. They victimized you. Okay, but what do you get out of that as a client? You could do that with your friends. If you want that kind of cheap validation, that is what friends are for, right? They can give you that for free. You don't need a mental health professional to give you cheap validation that you pay for, because your friends will do that for free. They'll tell you how horrible your ex is, or how horrible your current boyfriend or girlfriend or they them is. They'll tell you how terrible your boss is and how it's all their fault. But with your therapist, you want to be able to learn how to cope with those kinds of people, right? So because you're not going to be able to eradicate them, you might not be able to leave the situation, because it could be a family member, or like I said, somebody on the job, right, that you may need to keep. So the therapist, their job is to help figure out your perspective, help with you. What is your perspective? Why is that your perspective? How did it develop? And how can we cope through it, right? I know that was a tough one. What kind of questions do y'all have about that? I know that was a bit of a toughie. That was a toughie. Kind of questions do y'all have about that? Kind of questions do y'all have about your therapist, not just simply validating you, but helping you get through whatever your concern is with others. Questions? No? We still doing good? Hey, Persephone. All right, let's continue. Let us continue. All right. Okay. So, what are some other reasons that therapy may not work outside of working with a therapist that doesn't specialize in the areas of concern that you have? Working with a therapist that, you know, their ideals kind of run like their what they think kind of runs their practice, and a therapist that's just there that gives you cheap validation and doesn't challenge you. What are some other reasons? That actually is the majority. There are those three main reasons, other than the barriers to starting. These are issues that may come up after you've already started. So we discussed the barriers to starting therapy, and we discussed the barriers to maintaining therapy, right? Another barrier to maintaining therapy is if the client, right, also does not do their part. So if your therapist is prescribing you homework, or you're not showing up for your sessions, you know, and you're not taking an active role in your treatment, that's another reason therapy wouldn't work. So please be sure that if you feel like that may be a struggle for you, let your therapist know so that they can help. If you feel as though you're going to be inconsistent, or you're going to be inconsistent with completing therapy tasks, then let your therapist know that so that they can design a treatment plan that'll work for you, okay? Because that is a thing, right? People want therapy, but then it's like after they get in it, they may see that it's, you know, it's a little bit of work, because it is, right? It really is. It's just like if you go to the doctor, they prescribe you medicine, you have to actually take it. Just going to the doctor isn't enough. You have to actually take what they prescribe you. So if you go to the doctor for something and then you don't take what they prescribe you, you can't really get mad if you don't get better, right? Because you didn't engage in the treatment. So you got to be sure you're engaging in treatment. If you're engaging in treatment and therapy is not working, we can have a different discussion. But if you're engaging in treatment, you found a therapist that challenges you, normalizes things for you, but challenges you. You find a therapist that has not, you know, is not working with you out of their own biases, then and it doesn't work, then come back and see me, because that would be strange. That would be a strange situation, right? But if that situation happens, come back and see me and we'll see what happened, right? But the likelihood of it happening, if you're engaged in what you're supposed to do, you're doing the objectives, the therapist is doing the interventions, it aligns with your areas of concern, then you'll probably be part of the 80% of people that go to therapy and it is successful. Okay? How's everybody doing? How was it? I actually think that's enough. I think that's good. What kind of questions do y'all have? Questions, concerns, or comments do you have? None? None? All righty. Well, I'm just going to do this for the people in my community. For those of you that join the community, wait a minute. Okay, I think that's me. I think that's okay, what's your question? Thank you. I'm glad that the topic was helpful. What kind of questions do you have? None? Again, if you joined us late and you want to watch it from the beginning, you can click the link in our bio and join our other social media platforms where this live will be replayed. Okay? My father just passed away. How do you get a religious mother to seek grievance support? Ooh, well, that's the thing. We got to be respectful of how people choose or how people handle grief, because everybody doesn't handle it the same. So like maybe you wanted to dive right in to therapy. It may take your mom some time. So I would say with that, maybe the best way would be, this is just general and this is not the only way, but it may be best for you to maybe share with her how if you're in therapy, how your therapy is helping you, or if you're in a support group, how the support group is helping you. Because sometimes the best way to get somebody to participate in treatment is by sharing with them the example of how treatment has worked for you. Okay. So that's not an easy question, and that's not the only answer, but that might be the best place to start for you. Instead of trying to push her in, maybe you going ahead and start your own journey, and maybe just share with her how your healing journey is helping, or how the therapeutic resources that you're engaging are helping you. You know, that's a great question, though. Thanks for asking that one. For those of you that live in Alabama, let me put our information up so you can get connected to us. If you're looking for a therapist and don't want to look any further, can text the word new to the below number and we can get you set up. Or take a screenshot of this, and so your friends, family members, co-workers, church members can text the word new to this number. Also, feel free to copy and share the link in our bio to them as well. But this is the fastest way. Okay. My administrative team, they keep an eye on our text messages twice a day, in the morning and in the evening, so you will be answered same day. Okay. You can take a screenshot of this so you can share it with them. Did that help you, Christy, that answer? I was waiting to see if that was helpful. Good. All right. Perfect. All right. You're most welcome. Most welcome. All right. Well, that actually brings us to the end of our topic portion. But we will be doing our Cash App giveaway. Right? We're going to be doing that. If this is on sub only already, as far as sub only chat. Nope. Oh, it is. I never turn off the sub only chat. Sorry, y'all. We're going to be doing our Cash App giveaway. And if this is the last few days of this platform, we're going to go out, with a bang and let y'all do it. I don't know if it is. I guess we'll really see on Monday, but it's already on sub only. So subs, y'all know what to do. Put your CA in the comments so that we can add you. Let me go grab my tools so that I can make sure everybody gets a number. All right. So let me explain the rules to those of you that are new. I'm going to say your name and your number twice. All right. If I mess it up, I will say it a third time. But I'm going to say it twice. So if you are entering in the giveaway, be sure that you have your ears open. All right. So that you can hear what your number is. Because I'm not going to be able to remember it. Because if I sat here and wrote out the names and the numbers, it would take us a lot longer. I'm going to tally it. It's going to be up to you to remember what your number is, okay? So be sure that your ears are open, all right? Perfect. Let me start over here. I'm going to start over here, Instagram. I don't see anything. Okay. All right, let me start here then. All right, here I go. Listen up. Gonna say your name and your number twice. If I mess it up, I'll say it a third time. Persephone Golson, number 1. Persephone Golson, number 1. Toya Betts, number 2. Toya Betts, number 2. Christy Davis, number 3. Christy Davis, number 3. Lee Wiggins, number 4. Lee Wiggins, number 4. Victoria Carlisle, number 5. Victoria Carlisle, number 5. Adam Nance, number 6. Adam Nance, number 6. Sharon Gray, number 7. Sharon Gray, number 7. Danielle Wiggins, number 8. Danielle Wiggins, number 8. Kay Candles, number 9. Kay Candles, number 9. All right, let me go over here. Nini, number 10. Nini, number 10. Nini, number 10. I think that might be it. Okay. Cool. Well, good luck, Nene. All right. Cool. All right. Let's see here. We got 10. Let me get everything set up for everyone to see. Y'all know how I do it. I want everybody to see the process so they know, so everybody knows it's fair. I hope y'all enjoyed the live this evening. I really hope y'all did. Supply. All right, let me get everything set up so everybody can see everything at the same time. Let me switch y'all around, flip camera. All right, let me share the screen here so y'all can see. All right, so everybody's locked in. Let's random number wheel. Random number wheel generator. Okay. All right, so our minimum is 1. Our maximum is 10. All right, drum roll, please. Good luck, everybody. Drum roll, please. Number 10, oh my gosh! Not Nene actually got it, and we were like, wow, one person. You got it. That's a $150 cash out giveaway. You got it. Yay. Okay. Perfect. Congratulations. Congratulations. All right. Let me get that sent. And the way it works is once you get it, you let us know you got it. I'm going to cover your name and show everybody that I sent it. So I see it. Oh, Nene, have you won before? I don't think so. Congratulations from Yellowbird Counseling. All right. Cover it. Let us know when you got it. That's wild. We must have put some extra. That's why I share with y'all so y'all know, because that was so crazy. Let us know when you got it. Let us know. Did you get it? We're waiting for confirmation. Got it! Yay! Perfect, perfect. Well, She got it. That's what we got for this evening. Please join us next Thursday at 8 p.m. Central Standard, which is 9 p.m. Eastern, which is 6 p.m. Pacific, which is 7 p.m. Mountain, for our Mental Health Thursdays. And if I don't see you before then, stay warm, stay safe, and make sure you reach out and let your mental health be on the top of your priority list this year.